If you're one of the millions of women with postmenopausal osteoporosis, you probably hoped you'd never break a bone. But you see, when left untreated, osteoporosis is a disease that gets worse over time and can make bones thin and brittle. So what looks strong on the outside can actually be weak on the inside. But how does osteoporosis silently weaken your bones? Let's take a look. Throughout your life, your body is constantly removing old bone and replacing it with new bone. Osteoporosis brings an imbalance to this natural process, which causes bone loss and puts you at risk of fracture. In postmenopausal osteoporosis, you now have more bone-removing activity than bone-building activity. Why is this important? Because this imbalance is what makes bones more likely to fracture, even if you're simply bending or twisting. And that's not all. Once you've broken a bone, you're 5 times more likely to break another bone within 1 year. And who knows, next time it could be even worse. You could break a bone in your back, hip, or leg. Ask yourself, isn't one fracture enough? Now it's time to build new bone. It's time for EVENITY. EVENITY is an anabolic treatment for women with osteoporosis after menopause at high risk for fracture. But you can call it a bone-building treatment. EVENITY rapidly reduces spine fracture risk and builds new bone in 12 months. To see how EVENITY does this, let's take a look inside an osteoporotic bone. Here you can see there's more bone-removing activity than bone-building activity, which caused the bone to break. EVENITY works in 2 ways to unlock your body's natural ability to build new bone. 1, it increases the activity of bone-building cells. And 2, to a lesser extent, it slows down bone loss by decreasing your body's bone-removing activity. No other bone-building treatment does that. That's why you should talk to your doctor about EVENITY today.
Important safety information. What is the most important information I should know about EVENITY? EVENITY can cause serious side effects, including increased risk of having a heart attack, stroke, or death from a cardiovascular, heart or blood vessel problem. Call your healthcare provider or get emergency help right away if you have any of these symptoms. Symptoms of heart attack, which may include chest pain or pressure, shortness of breath, feeling lightheaded or dizzy, or symptoms of stroke, which may include headache, numbness or weakness in face, arms, or legs, difficulty talking, changes in vision or loss of balance. Before you receive EVENITY, tell your healthcare provider if you have had a heart attack or stroke, especially if it has happened in the past year. Do not receive EVENITY if you have low blood calcium or are allergic to romosozumab or any ingredients in EVENITY. Before receiving EVENITY, tell your healthcare provider about all your medical conditions, including if you have a history of other heart or blood vessel problems, have low blood calcium, cannot take daily calcium and vitamin D, have kidney problems or are on kidney dialysis, plan to have dental surgery or teeth removed. What are the possible side effects of EVENITY? EVENITY may cause serious side effects, including serious allergic reactions have happened in people who receive EVENITY. Call your healthcare provider or go to the nearest emergency room right away if you have any symptoms of a serious allergic reaction, including rash, hives, swelling of the face, lips, mouth, tongue, or throat, which may cause difficulty in swallowing or breathing. Low calcium levels in your blood, hypocalcemia. EVENITY may lower the calcium levels in your blood. Your low blood calcium should be treated before you receive EVENITY. Call your healthcare provider if you have symptoms of low blood calcium such as spasms, twitches, or cramps in your muscles, numbness or tingling in your fingers, toes, or around your mouth. Severe jawbone problems, osteonecrosis may occur. Your healthcare provider should examine your mouth before you start EVENITY and may tell you to see your dentist. Ask your healthcare provider or dentist about good mouth care. Unusual thigh bone fractures. Symptoms of this type of fracture include new or unusual pain in your hip, groin, or thigh. The most common side effects of EVENITY include joint pain and headaches. These are not all the possible side effects of EVENITY. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov cdc.gov/medwatch or call 1-800-FDA-1088. Ask your doctor about EVENITY. Please visit EVENITY.com for full prescribing information, including medication guide.
So if you've broken a bone due to postmenopausal osteoporosis, speak to your doctor about rapidly reducing your spine fracture risk and building bone in 12 months with EVENITY.